Welcome to the hip routine. You can be on a box, a bench, or even in a chair for this. You'll want to grab a stool and just set it aside. We'll need that in a little bit. Some of you will want to see how far along you are. This is a 15-minute timer. You can set that down, and you should have been warmed up a little bit. Either a bike, a treadmill, a rower, something to get some movement through the hips and pelvis. We're going to start by asking you to cross your leg and lean forward. If there's pain with that, or if you cannot cross your leg easily, this routine may not be for you. Feel free to follow along and get some information about how you're feeling. But we might want to do something a little bit different if this really spikes your pain. There is a difference between stretch pain and picking at the scab of a healing wound. Some of you who do this routine might have some bursitis or some sciatica. We will do this routine quite a bit for people with low back pain, knee pain. And so just an opening sort of ground rule would be, if you get started and there's some discomfort that eases up with stretching, we're good to go. If there's discomfort that seems to ramp up with stretching, then we probably need to do something else. So a few of these to get started, and then we're going to grab the knee with both hands and pull towards the chest. And you can look down at your clock. We're going to hold this for about 10 seconds. Our preferred method would be, instead of watching the clock, it would be something more along the lines of breathing. So taking a deep breath, let it out, breathe in, let it out, breathe in, let it out. Usually 3 deep breaths per stretch is good. As we get going into the stretch, you'll want to see if you can feel it here in the back pocket. Some people will have it all the way down into the hamstring along the sciatic tract. But we're looking for a stretch somewhere in this area. Rhythmic breathing while we're stretching signals to the autonomic nervous system that we're relaxing, we're safe. That's a good way to get your body's own natural muscle relaxants to start to flow. Some of you might have a pinching pain in the front of the hip. If that's the case, you'll want to keep your knee out here to the side a little bit more instead of bringing it across your body. If you're comfortable bringing it across your body, you can double down on that by reaching deeply and even twisting a little bit and looking over your shoulder as you stretch. If there's discomfort in your back, SI joint, hip, front of the hip, we might not want to stretch this aggressively. So just stick with what's working for you, but this is an advanced version. Breathe in. And you may have been able to see that with that advanced version, each time there was an exhale, we sort of took up the slack on that stretch. We're going to bring the stool out in front of us and get the hamstrings involved. So we're going to keep our back nice and flat. Let me show you from this angle. We'll keep our back nice and flat, sitting upright, foot out in front, pop the toes up so that there's a nice dorsiflexion angle. And we're going to lean forward, feel the stretch, hold. Sinking a little further into the stretch after each exhale. Switch feet. I like to keep just a little bend in my knee when I do this. I do have some neural tension. My foot can kind of go to sleep if I overstretch here. So I like to do it without overdoing it. Back nice and tall versus this. We're not really interested in this right now. We want this sort of a stretch. So head and chest stays up, collarbones are elevated. We've rolled forward on the pelvis, so we're sitting on our sit bones, not resting on our tailbone. We're upright, leaning into that stretch. There we go. Start to feel it. Hold it for 3 breaths. Often we find tight hamstrings with our low back patients, with our knee pain or sciatica patients. So stretching your hamstrings in a comfortable and effective way without irritating the back, because lots of us will have reasons why we don't want to round out the back and stretch our hamstrings like this or like this. So this is a nice neutral way to stretch the hamstrings without putting undue strain on the discs of the lumbar spine. So coming in and out of that stretch is allowed. Make it work for you. You just want to touch that tension behind your hamstring, knee, calf. Some people will feel this all the way down into the foot. Bring some love into the hamstring, into the calf, into the sciatic tract. That feels so nice. Why don't we do it one more time on each side? We can reach. But what we don't want to do with this is like stretch the way we did in the 6th grade where you're bouncing. That's not how we stretch now. We hold, we breathe, we sink into that stretch. We find a lot of value in stretching in about the 70% range. So if you can go a little bit further, it's not always necessary to take a stretch to its 100% range. We're going to get a lot of the physiological benefits of stretching in that 70% range, especially when all these components are lined up. The dorsiflexion, the neutral spine, the anterior pelvic tilt, all of these things are going to make that stretch even more effective, which is why I'm doing this on a video, because my support staff, I just can't expect them to know and understand all of these nuances. So it's one of the reasons why we put these stretching videos together, so that I can share with you the things I would share if I had the time to teach everybody. And so now we're going to open up the hip. For those who have degenerative or nagging knees, this you might want to go slowly on this one. But the goal here is to find some stretch in sort of the side pocket area. Some of us will feel it in the hamstring as well. It's again, sitting up nice and tall, pressing down and leaning forward. Hold, 2, 3. Breathe, 2, 3. Lots of people will hold their breath during a stretch, which actually ramps up the nervous system, making it a little harder to relax and get the full benefit of a stretch. So try to resist the urge of stretching like this. Okay, we're not trying to stretch like Hulk Hogan or some madman. So if your face is turning colors while you're stretching, we will know it. This I can feel in the inner groin, but it feels nice to bring some flexibility. Often we'll notice one hip is a little bit tighter than the other. I would say most people have a right hip tightness. I think that has to do with how we drive and how much external rotation we live in on that right side with our cars. It's sort of my best guess. Haven't done the research on that, but observationally, a lot of people have a tighter right hip. So if that's you, you are normal, you are probably American, and you probably drive a lot of places. So we call this the figure 4 stretch. Be careful on how it feels on the knee. This is a lot of compression on the knee if you have a meniscus tear, or if you're a little tight through the knee. Maybe don't crank down so hard. Allow that to stay soft while you lean into it. Leaning in and holding. If you want a little more of a stretch, lean your body weight onto that leg. Oh yeah, I can feel that here in the outside. Right here in the outside of the hip. But I also feel it in the groin, kind of in the adductors, or that inner thigh. And speaking of which, we're now going to stretch the inner thigh by opening up, sitting up nice and tall, placing your hands sort of on your knees and opening while squeezing your shoulder blades, sitting up nice and tall and just leaning forward. Hold, 2, 3. Breathe and hold. If you're not super comfortable with that, we can try to do one at a time, or bring the step in here to it. And you want to feel the inner thigh stretch. That does it for me, even with this much bend in my knee. Bringing my forearm here to kind of block the knee so it doesn't roll in is helpful. I can even feel that a little bit over here as well. So open, little butterfly type stretch, modified for us over 40 folks. That's really nice. That one might be an irritation, so go slow. Listen, don't overdo it. You can always go a little bit deeper on the next one. This leg is sort of wanting to cramp up a little bit in my deep glute, so I'm just going to go a little bit slower. Focus on this guy. I skipped my warm-up to go straight to the video. So if you start to feel a little bit crampy, perhaps spend a little bit more time on your warm-up. Go slow. It's okay to make it your own. We can even try to put your feet up on the stool. This might be enough of a stretch for some of you to stretch that inner thigh. The key here is to not, that's our 15-minute timer. The key here is to not round your back and overstretch. The key is to sit up tall and just engage that inner thigh. One at a time if you'd like, or both at the same time. So that is our box stretch routine. We'll do this for anybody with knee pain, sciatica, hip pain, bursitis, low back pain. The hips are an incredibly important part of our lower quarter and our lumbar spine. So I hope you enjoyed the practice. If you had anything that didn't feel right to you, make sure to review that with your physical therapist. You're probably doing this prior to them seeing you. So give them some feedback and they can help you troubleshoot if any of these stretches were a problem for you. Thank you.